you have to burn that skin. And maybe you're thinking, are you crazy? How are you going to burn a skin of a patient? Yes, you have to do that. You're going to have marvelous results. Hello, how are you? I'm Dr. Acevedo Marie Angel, and this is Learn with Dr. A. So, welcome here again. I am very thankful that you are seeing all these new videos, this new project. Well, I am Dr. Acevedo. I have 17 years in aesthetic medicine practice and 10 years teaching aesthetic medicine around the world. So, today's video is I want to tell you why you have to burn your skin patient and even your own skin. Why? Because you're going to deal with a chemical peeling. And this is the difference. A chemical peeling is a burn, but it's a controlled burn. And I'm going to take this thing here. Okay, you know what is this? This is, to modulate the volume and the effect of a mic, of a microphone. So as you can modulate the things on a mic or a microphone, you can also modulate how you're going to burn and how deep are you going to go in that skin. So this is the first important concept that I'm going to give to you today. A chemical peeling is a controlled burn, and it's controlled by you, by the person that is applying that chemical peeling on the skin. So you're going to ask, okay, how I'm going to control a burn in the skin? Very easy. First, you have to remember that the skin has different layers, okay? So I have the epidermis here and the dermis here. So epidermis is the letter A, dermis is the letter B. When you're doing chemical peelings in the letter A, they are superficial and very superficial. When you're doing chemical peelings in this letter B at the dermis, you're doing a medium depth or deep chemical peeling. So chemical peelings you can classify in, three, but for learning purpose, I like to classify them in 4. The first, very superficial. You're going to remove only skin layers 6 and 5. Only, very thin of the epidermis. It's the most chemical peelings that you do by yourself in your home, for example, with a 10-15% glycolic acid, or when you go to your cosmetologist and they apply a very thin layer and you feel like a little itchy, and you go out and you only feel that the skin is shiny, softer, but you're not right. Then where we have superficial peelings that they are going deeper, okay? But the key point, the second concept here, the difference between a superficial medium depth chemical peeling is that you are not going to pass the membrane, the basal membrane, okay? Which one is the basal membrane? If you see a skin, and I'm going to, you can see the picture, you have here is the basal membrane which separates letter A from letter B. Is this, thing here that is green that separates the epidermis from the dermis. And in that basal membrane, that is very important, it's a key cell here. It's the melanocyte. In a previous video, I talked about the melanocyte, that the melanocyte is a cell that is like a squid because it has tentacles to here, okay? So the biggest difference between the peeling that is superficial or is medium depth is that that peeling goes up to the basal membrane. And I'm going to give you an example. If you have a tattoo, or if you ever have done a tattoo, you know that the tattoo, when you are doing that tattoo, it hurts and also bleeds. Why it bleeds? Because the tattoo is going deeper, it's going to the dermis. So the chemical peeling, the superficial and very superficial goes up that part, up to the basal membrane. The deeper and the medium depth goes in the dermis. So I'm going to talk you to something. Right now, it's more common that everybody has tattoos. So if your patient has a tattoo and tells you, I don't want to do a chemical peeling, you ask, do you have a tattoo? We should do to you a chemical peeling, because when we have now an idea of how your skin is going to react. So we have also medium peelings and really deep peelings. The medium peeling goes up to here, around the middle of the dermis, and the very deep peelings, or the deeper peelings, go all through the dermis, so it removes everything. So it's not the same. When you burn your skin, for example, with, I don't know, okay, I'll give you a very easy example with lemon. If you burn your skin, for example, with, the acid from the battery of the car, that's not the same. So you can do the same when you're applying to yourself or to your patient a chemical peeling. So we have, for example, I'm going to put you, a skin. How we classify very superficial, medium depth, and deep peelings. You can do, a screenshot of that, and you can have that. So, but I'm going to tell you very fast. Very superficial peeling, glycolic acid less than 10%. Okay, first, for example, mandelic acid, alpha hydroxy acid like salicylic acid, azelaic acid 10%. All of them are very superficial peeling, and that's the reason you can buy them over the counter or even in a pharmacy. Okay, we have superficial peelings that going deeper. We have there retinoic acid more than 2%, 3%, 5%, even 10%. Oh, sorry. In very superficial peelings, we also have retinol and retinoic acid that goes more superficial. Very superficial. So again, I'm going again with the superficial. They're going deeper, but they don't pass the basal membrane, remember. So retinoic acid, 3, 5%, 10%, glycolic from 30 up to 60, 70%, TCA, 50%, 20%, and this is another important concept that I want you to know, and this is one of my secrets here, okay? TCA is a chemical peeling that is very good, but in patients that are Latin, Hispanic patients, or Asian patients, it could irritate a lot, and you could have a hyperpigmentation, even if you have a percentage of 7%. Even with that, you could have that very strong, very hard to treat post-inflammatory hyperpigmentation, okay? Please put that and write that, because this is very important for you. So we have, if you are going deeper, okay, we're going to the dermis, that's very good for scars, for example. We have TCA up to more than 50%. We have glycolic acid 70%. We have phenol. We have, phenol, TCA, and we have the deep peeling that is phenol, for example. But TCA is 70%, 80%, even you could find 100%. But what is very important for you to know, phenol is a very strong peeling. It's a little bit dangerous. The phenol is a chemical peeling that should do in an operating room. You should have, a cardiac function monitoring. You need to have a monitoring of the renal function, because the patient could have, arrhythmia, and could die. Even there was a case in, I think it was last year, and at Brazil in 2024, that a patient died in a clinic because of complete phenol. So today, what is the point here? You have to be aware of what you are applying. So you can burn that skin. You have to burn the skin to have very marvelous, very gorgeous changes for acne, for hyperpigmentation, for scar, for open pores. But you have to know what you are applying and if your skin is good for that type of peeling. So please check it out. The previous, chapter number 1 and number 2, where I talk about phototype, but I can resume you very fast. So As darker the phototype, you have to be more careful and more superficial. As lighter the phototype, you can go deeper, okay? But always remember, if you are learning how to do chemical peelings, or if you're applying it yourself, please try it before. For example, here, remember to use sunscreen, and please try first with a very good friend and a family member that you could apply that. So in our next chapter, I'm going to talk to you a little bit more how to perform a safe and successful chemical peeling, okay? So please remember to share, comment, tell me what you want to talk me to, what to talk you about. Oh, as you see, English is not my first language, but I do my best. And please, let me know what do you want to know about aesthetics medicine. This podcast, these learning classes are for people who want to learn about aesthetics medicine, medical doctor, nurse practitioner. So please let me know, share, comment, like, and please subscribe to my channel. That by this moment, everything is done by myself, and I have a little bit help, but you can help me a lot to have more things for you to learn a little bit faster and easier. So see you later. Bye bye. Thank you.